Hey, it's Dr. Schmidt. I have two things I want to share with you. This will be really quick. So I talked to a patient this morning, and I talked to her one time before 1 month ago. And here's her story. So about 2 months ago, she started having high blood pressure, and it was averaging 145/85. She went on 10 milligrams of lisinopril, and that brought it down to normal. And she's trying to figure out, why does she have high blood pressure? She's not deficient in lisinopril. So she and I talked a month ago, and it's mold in her house. It's orange mold. And what's interesting is that when she had moved into that part of Oregon where it's humid, they get 90 inches of rain per year, within hours of moving there, her right foot swelled up. So that's an indication that there was something lingering in her body, and she had moved from California where it was much drier. And so when she and I talked for the first time a month ago, she's telling me she's got mold. She knows that that's got to be the issue. So I gave her some supplements, and I gave her the antifungal diet. And now, 1 month later, she's been able to reduce her blood pressure medication from 10 to 2.5 milligrams. And this morning, her blood pressure was 106/75. So she's basically done with the blood pressure medication because even that's too low. So that's super interesting. And it brings up the point of like where I grew up, Northwest Ohio, and now I'm in southeastern Michigan, only an hour away from where I grew up. It gets cold here in the winter, and it gets humid in the summer. And when people had a problem with their heart back in the 60s, 70s, 80s, their cardiologist would tell them to move to Florida or something like that. Move out of the area where it's going to be nicer weather. Avoid the extreme cold. So people would be in Florida in the wintertime where the weather was beautiful and move back to Ohio and Michigan and avoid the humidity of Florida. And I've talked to people who, they fly out of Detroit, let's say they're going to Phoenix or someplace in the American Southwest, and they feel better immediately stepping out of the airplane because the dryness of the desert, it puts a damper on the mold in their body. So there's a lot of people with heart problems and high blood pressure, and it's because of mold, candida, yeast, fungus, whatever you want to call it. And certainly there's people that have blocked arteries, like that's obvious too, but when people have no blocked arteries on their medical tests, but yet they suffer from heart issues, that's mold. Okay, the next thing I want to talk about is, this is a company that I chose to buy from, and they have a blue blocker cover that goes over the phone. All right, so that's the name of it right there, AccuShield. And the reason why I found this, we just went on Amazon, read the reviews. It's just like a piece of plastic, if you will, that a lens kind of that goes over the phone. And you want to block that blue light that comes off your phone. Now, you may have heard about this, but blue light coming off the phone, iPad, laptop, etc., it's damaging to the eyes. And you want to not have damage to your eyes. Here's the one that I got, same company. This is for the laptop. It's much bigger. I have a 15.5-inch screen. So there's a lot of information about this. I'm not a specialist in this, but if you are looking at a computer a lot and you wear glasses, you can get your lenses to be covered with the blue blocker. Okay, I don't wear glasses or wear contacts, so that's why I chose to cover the actual screen of the phone. Now with iPhones and other phones, you can actually dim down the blue light as an app, if you will, like it'll be part of the features of your phone. But to be honest, I'd rather have that turned down all the time, and I don't trust the phone enough. That's why I have this blue blocker plate cover that goes over the phone. All right, so I just wanted to share that with you. I just installed these yesterday. All right, so there's my update. If you want to be a patient, call the office. We do have an email address, but we prefer the phone calls, and below this video is in the description box is how you can do that.